Thank you for joining me. I hope you can hear me very well.
Yes, I can. Hello, everyone.
Hello, hello. Thank you
Thank
very
you,
much.
Nurse
So I'm just going to
Jonathan.
put you on the spotlight right now, okay? And then you can go
Okay,
ahead. Thank you very much.
yep. Hello, everyone. I'm Timi Oguntoye. I'm a doctor, and I'm glad to be here again. So we had this program, I think, last year. It was a stream on, oh, was it stream now? I've forgotten what they call it on Twitter Space. Yeah, it was its Twitter Space, and it was it was nice actually talking about diabetes, the management, and we had a lot of input from people, people that were newly diagnosed, people that have been living with it for a long period of time, people that know people that are living with this disease and are managing it, and it was nice to be among that. And I'm glad to be here again, doing this again 1 year after. So thank you for joining. Thank you, Nurse Jonathan, for hosting this. You're doing great work. And that's it. So about diabetes, mainly we're going to be talking about type 2 diabetes here because that's the one that is kind of modifiable. But about diabetes in general, diabetes mellitus, that's the one we're talking about because that's the one people know about. And when people talk about diabetes mellitus, we're talking about increased blood sugar. So say, you have high blood sugar, you have diabetes. You have high blood sugar, you have diabetes. It's not exactly like that. There's a diagnostic criteria. It has to go above a certain level persistently and with or without complications. Leave that to the medics to look at the criteria. But high blood sugar, hyperglycemia, that's what diabetes mellitus is. And it happens as a result of when there's a problem in the metabolism of carbohydrates and of food in general, because there are some other food components that have some bits of the end product is sugar. And then when the sugar is not being utilized by the body, it builds up in the blood and gets past a certain level and then causes damage to different tissues in the body. And that's what hyperglycemia is, also known as diabetes mellitus. And the major thing is there are two types, major types. There are other so many different types, but the major ones that are the type 1 and type 2. And the type 1 is the one that is usually genetic. That's the one that you really cannot modify the risk factors. But type 2 is the one that may occur maybe as a result of some other risk factors that I'll be talking about later. And there's this other one, gestational induced diabetes. What it basically means is that some people get pregnant, and when they are pregnant, the metabolism of sugar is somehow affected, and that causes the blood sugar to go up. But usually, it should resolve after pregnancy, but that also kind of puts them at risk of having type 2 DM later in the future. Doesn't mean they will have it, but puts them at risk. So the one we'll be talking about majorly today is the type 2 diabetes. And what happens in type 2 diabetes is that there are some cells in the body, in the pancreas, that produce insulin. And this insulin help the body tissues to absorb sugar, to absorb glucose. But when this insulin is not being produced enough, or the body doesn't react properly to it, that is, the body doesn't realize that the insulin is there, or the body can't utilize the insulin effectively, then the sugar builds up, and then that's hyperglycemia, diabetes mellitus. So that's basically what diabetes mellitus is as per introduction. So what are the risk factors of this diabetes? What can we do to prevent it? What can we do? Or what are the things to look out for? Yes. So there are modifiable risk factors and there are non-modifiable risk factors. Let's start with the non-modifiable ones. So someone with the family history of diabetes, especially um, maybe your parents or your sibling, that's a risk factor. And there's really nothing you can do about that. You can't change your parents, you can't change your family members, but that just means that you have to take some things more seriously. That means that you have to take the modifiable risk factors more seriously and try to reduce your chance of getting that, or the reduce the or increase the amount of time it's going to take for it to happen. Maybe something is supposed to happen at the age of 20 and then it happens at the age of 40. You've been able to delay it a while. Yeah. So usually in the past, we used to say age was a risk factor, like the elderly. Diabetes used to be a thing for the elderly, but it's not so these days, actually. So many young people in their 20s, even people less than 20, are coming down with, or they are being diagnosed with diabetes mellitus. And so it's no longer a disease of the elderly. And that's why we have to create awareness about it. That's why we have to talk about it so that people know about this. And also people that have um, diabetes, they can learn how to manage it. And also, if you have family members, you have friends, you know how to support them and how to help them manage this disease. So, age is no longer like a very significant risk factor like that in the sense of things. But another risk factor is obesity. Now, that could be a reason why younger people are coming down with this, because increased when there's increased BMI, that's your body mass index, when it's raised, when there's weight gain, when there's a lot of fat tissues, there's in the absorption of insulin and in the production of insulin and in the utilization of insulin, hormones begin to play up and down, and then the sugar metabolism is disturbed and things happen. That's why also people with hormonal problems, PCOS, they might come down with things like hyperglycemia. And that's why they'd say one of the management of PCOS is to manage the weight gain, and they can manage the sugar and things like that. A lot of people are going through different things, and it is not easy treating hormonal problems, trying to get your weight in the right bracket. It's not easy, but these are things that we have to do just for ourselves, to so that we can live a, a life with better quality, and we can go on to do other things. Like you can, that's it's when you're feeling fine, is when you're doing well, when you're healthy, that you can do well at your job, that you can have good relationships, that you can travel and do things. So that's that. Weight gain is a modifiable risk factor. Another risk factor is the smoking. Yeah, smoking. It's, I don't know if it's getting more I don't know, common or not. But then there's vaping, the other one too. So smoking, vaping, also drinking alcohol. These are risk factors that are modifiable. If you're doing any of these things, you can try to cut it down. You can seek help with social communities, and they can help you cope that, so that that will reduce your chance of having diabetes and other health problems. There are so many health problems attached to that. So also, if you're of black descent, Africans, Asians, there's nothing you can do about that one. That's a non-modifiable risk factor, but it does put us at risk. So having a positive family history, being black, those are already two risk factors. So if you're smoking and you're drinking, that's just adding to it and increasing the chance of coming down with diabetes mellitus. Enough of the risk factors. What are the symptoms? How do you know? Sometimes you might not know, because type 2, most people really don't know that they have diabetes until maybe they get really sick and they go to the hospital and they are being treated, and they have to check the blood sugar, and they say probably you're having these symptoms because the person has diabetes, or the person's blood sugar is high. And by that time, a lot of damage is being done to the tissues. So what are the symptoms? Number one, you could notice that you're eating more frequently than normal. Polyphagia, these days I'm just eating more and more. You're eating 5, 6 times daily. And really it's because you're hungry. it's not because you just feel like eating, but you're really hungry and you're eating more. And it's not like you need this food. Like maybe the amount of food you eat to the amount of exercise or the work you do, and you're just eating more and more and more, and you're not pregnant, and it's not like you're doing more work physically that you need more calories, but you just end up eating more and more. That could be a sign. Also, polydipsia. I know Nigeria is hot. You're drinking a lot of water, but then you notice that you're drinking more than 3 liters. You are drinking 4, 5, 6 liters per day, might be a sign. Polydipsia is a sign. Also, and that's because there's increased thirst too. So it's not because you just, if I give you a jar of water and you're not thirsty and I tell you to drink it, you probably will be bored. Why? Water is not sweet. Water is not really exciting like that to drink. But then you end up drinking in excess. That could be a sign. Another sign is that person someone could start having recurrent skin infections, recurrent boils, one boil here today, another boil here tomorrow, another boil here next tomorrow, and you're wondering what is happening. Different yeast infections in different crevices of your body. So those, that could be a sign that, oh, there's something wrong with the sugar metabolism, because all these organisms, there are some organisms naturally that on our skin, in our body, they are there normally. There's nothing, this is not about whether you're clean or you're not clean, or you are taking your bath or you're not taking your bath. But then these organisms are not meant to cause infections. But by the time they start causing recurrent infections, could be a sign that, oh, there's a break in the immunity, in the protective barrier, and that could be because of diabetes mellitus. Another sign could be that when you go to pee, you notice that, well, this one is not very common, but people, you could notice it also. Maybe you go to pee in the toilet and your urine is just foamy, like you pour detergent in and mix with water. So you just see that the urine is getting foamy a lot. And this is not your usual. This is not normal. So that could be a sign. Also, recurrent urinary tract infections. That's not something that anyone should be having. So it could be a sign that someone has diabetes mellitus. Weight loss, weight gain. Well, those are not in type 1. Maybe weight loss could be one of the symptoms, but in type 2 is not so much significant like that. So um the major ones, also there could be visual disturbance. Suddenly vision just gets worse, and it's not like you're aging, you're not in your 40s, you're not in your 50s, and it's not like you've been using glasses before or anything. You just notice that you're not seeing, your vision is just getting blurred. It could be as a result of the blood sugar being elevated. So aside the symptoms now, we'll talk more about symptoms when we get to complications. What are the things that can be done to manage this disease? So you get to the hospital for whatever reason, you're having symptoms, or you're just going for a regular health check, and they check your blood sugar and they're like, has anyone ever told you your blood sugar is raised? And you're like, no. And they're like, okay, maybe you should go to the hospital. That's, most people ignore that sign. And by the time they are coming to the hospital presenting with whatever symptom or disease, and it has flared up, and you're asking them, has anyone ever told you that your blood sugar is rising? I'll be like, they told me one time I went for a medical outreach, or one time I went for a health check, but I just thought it was nothing. No, that is the wrong move. Anytime you do an health check and someone tells you your blood sugar is raised, please and please do not ignore it. Please and please, I'm begging you, do not ignore it. It's better for you to get to the hospital and for them to check and say, oh, there's no problem, or just come back for another health check in another time, than for you to ignore it, and a lot of problems are going on, and some of them life changing, some of them permanent, and we wouldn't want that to happen. The earlier, the better. The earlier is diagnosed, the better for you, the better for us, because early diagnosis, early treatment, that's what will make the life of the healthcare worker even easier, because we know we can counsel you, we can monitor you, than we starting from the complications of the disease. So please and please do not ignore you're having symptoms, not ignore your health. You you have a family issue, or even if you get diagnosed with it, please talk to your family about it, talk to your friends about it. Why? Because remember I said having a positive family history is a risk factor. So imagine you're not telling your siblings, you're not telling your parents, you're not telling your children, you're putting them at risk and they don't know, and that's kind of unfair to them in a way. Also, if you let them know, they can support you, because in the management of diabetes mellitus, there's the dietary changes, there's the lifestyle changes, there's the exercise, and so many things. These are people that can look out for you. These are people that when you're having, they can know about the signs of the complications when you're having either a crisis due to high blood sugar or low blood sugar. They can look out for you, call an ambulance for you, remind you about your medications, just to make your life easier. So please, if you get diagnosed with it, you need social support. The importance of social support cannot be overemphasized. Just like being diagnosed early and starting treatment early is very important. So one, we've spoken about diagnosis. Two, we've spoken about social support. The other thing now is the treatment. In the treatment, for some people, they may say, okay, let's just watch your diet, and the dietitian is going to talk about that later on a grander scale. And that in itself, treatment has started. Some people will be like, I'm not using any medications. Treatment hasn't started, or treatment has started, even right from the diagnosis. Treatment has started. Counseling is part of treatment. Dietary modification is part of treatment. Medications and using insulin is part of treatment. All part of doing health checks, checking your feet for wounds and all of that. Even the social support is still part of treatment, because this is something that is not going away anytime soon. I believe in miracles, and yes, God does heal people. But pending that time, and while you're waiting on your miracle, it's very important for you to take management very seriously. So, yes, we've talked about um, social support, we've talked about early diagnosis, and we've talked about what else I've talked about? Sorry, I forgot. So yes, treatment. Now there's the injectables, that's the use of insulin, and there's the tablets. The pharmacist is going to talk to us more about that. But things to look out for, please. The advice that comes with the medications is very important. If they say take before food, don't take after food. If they say take after food, don't take before food. If they say take once a day, don't do TDS. That's 3 times daily. If they say 3 times daily, don't do once a day. Don't skip your medication and do a double dose. In fact, that's like putting yourself at risk. Don't fast yourself unnecessarily and say, oh, so because I fasted myself, I'm going to skip this dose. If you've not been advised to do so, the treatment of the management of diabetes is solely based on a good glycemic control, a good glucose control. And you can only have a good glucose control when you're watching what you eat, how you take your medications, and the lifestyle modification, even down to the timing you take your medications, very, very important. Because the complications of diabetes mellitus, maybe we should just go into that. Complications of diabetes mellitus can range from hyper to hypoglycemia. So the blood sugar is too high, problem. You treat excessively, blood sugar is too low, problem. So there's a range. The body needs sugar to function, but excess of it is not good. And when there's not enough, it's a problem. So having a good control is the key, is the key. So please and please, I'm going to take this moment. It seems like I'm begging, but the reason why I'm doing this is because there you see so much people, so many things that could be avoided. Diabetic foot ulcers that could have been treated. Don't ignore any wound. You see one tiny wound is not, or just one bone infection and one small tiny ulcer and it's not healing. So, my enemies, people are doing this, people are doing that. Could just be something that treatment, medications, good skincare, good ulcer care will take care of. And ignoring that small thing is something that will flare up and cause problems, even to the point that a whole limb can be amputated. Seeing people, both limbs, more than two limbs being amputated, and this is something that could have been prevented. It is a disease that is going to be managed for lifelong, lifelong. So yes, it can be a lot to take in. It is a lot to take in. From the diagnosis, you will get tired. It's not easy taking, watching what you eat, taking medications every day is not easy. But the way to not get tired is when you have good social support. Do not ignore your clinics. When you go to clinics, the reason why you're going to clinics is not only just for the health checks, it's just so you can get encouraged. If there's a new medication, you won't know if you don't go. Because imagine you're taking two, three pills and there's just one pill that could do the job. It's just like putting yourself through all these troubles. And when you go to clinics, in fact, there are clinics dedicated to diabetes. It's not just you go along with everybody. So this is diabetic clinic, and there you have dietitians, there you have pharmacists, there you have nurses, there you have even the mental health team. They are there to support you and and give you everything you need. Sometimes they give free drugs, they give free treatment, they do free screening, a lot of things that you can miss out on if you don't attend all these clinics. So please and please, you've done well by coming here, and thank you very much. I appreciate you for joining this program, but you can do better. You can take it forward, talk to people about it. You know people about it, support them. I mean, you know people that are diagnosed with diabetes, support them. You've been newly diagnosed with diabetes. I'm very sorry that this is happening, but it is something that can be managed. I've seen people 20 years, 40 years, and they are doing well, doing very well, doing very, very well. Being diagnosed with diabetes is not a death sentence. It's something that can be managed, and we are here. People are here. People are around to support you. You just have to link into this support, and let's see how it goes. So thank you very much for coming to this program. Thank you for inviting me to this program again. This is another year, and hopefully next year this will happen again. Thank you very much.
Thank you so much, Dr. Timmy. Yeah, thank you so much for that. I believe someone watching us has gotten something great, valuable, and I trust that you're learning already. All right, so I'm just going to play a quick advertorial for for an interlude before we go on to have the pharmacist share one or two things with us on the drug management, how to best use your drugs to prevent some terrible things that could even happen with the use of drugs. It's so unfortunate that diabetes is incurable at the moment. Yes, there's a lot of work going on to find a cure to it, but hopefully soon we get a cure. However, pending that time, we need to keep taking our medications, all right? And for that reason, we need to know how to take it, when to take it, how to